Working in the health and justice sector supports some of our society's most vulnerable people and helps to improve their health outcomes, as well as to offer the opportunity to change their lives. Working in this sector can be extremely rewarding, and there are many opportunities available for staff working in the health service that are looking for a varied and stimulating role. There is little awareness of the diverse and unique careers available to clinical staff, and this film provides you with a snapshot of what it's like to work in this sector, from those who know best. A selection of people who are currently working with the police and with HM prisons in the southeast.
Hello, my name's Bella Lee. I'm the lead nurse at HMP Elmley. I came into prison nursing as a registered general nurse. I'd had experience in A&E and I'd had experience in general medicine. We're working within a prison regime, so it's a very organised day. We have 1,200–1,300 men are my patients every day, and they range from needs as small as I've cut my finger in the workshop, to having a heart attack, to needing care for their diabetes. Well, the brilliant part about my job is that there's no typical day. No, there's nothing typical about a day. There might be a fight, or somebody has gone to the gym and has had an accident in the gym, or someone's fallen down the stairs, someone's had an asthma attack. The preconceived ideas are that these prisoners are going to be unruly, challenging, rude, abusive. More so you see that in an A&E department on a Friday or Saturday night in the NHS. One of the things that I didn't understand when I joined the job, and it didn't really matter how much people tried to reassure me, it wasn't until I actually started working within the prison service that I realised that you are never alone. You really are a member of a very big team of people, and I've never, ever, not a single moment in my job have I ever felt threatened or unsafe. You can have an NVQ level 2 and 3 and come in as a healthcare assistant. You can be a registered general nurse or a registered mental health nurse. There is a place for you. The ideal candidate for a person wanting to be a prison nurse is somebody who is able to work autonomously within a large multidisciplinary team, providing a health service for men and women who have complex health needs within an environment that can sometimes be challenging.
My name's Rebecca Wild. I'm a crisis worker employed by Mountain Healthcare at the SARC, which is the Sexual Assault Referral Centre in Maidstone. We take referrals from police or self-referrals for victims of sexual assault and rape. The crisis worker's role is really to support and advocate on behalf of the victim, give them some emotional support when they arrive, liaise with the police if they've come with a police referral, and to assist the forensic nurse examiner in their forensic examination. And then we would be responsible for making referrals and signposting the victim on after they've left us. As a crisis worker, there's no set qualifications that you would need. It's clinical skills. If you've got any experience as a healthcare assistant, that would be really good. Really skills in empathy, organisational skills, and some knowledge of safeguarding would be good. I know that there have been people before that have joined as crisis workers that have gone on to qualify as nurses and then been re-employed as forensic nurse examiners. I think the best thing about this job is working with victims and supporting them, knowing that you're making a difference to somebody that's going through a really hard time, that's going through something really difficult, and you can have that impact on somebody's life and make that a little bit easier, supporting them through something that is possibly going to have a larger impact on their wider life. The best advice I can give somebody who's interested in working at the SARC would be just talk about your passion. If you're really passionate about working with victims of sexual assault and rape, and that's something that you want to come into, then I would definitely say apply. If you've got an interest in the criminal justice system or the healthcare sector, it's definitely a really supportive environment to work in and somewhere where you can get some really good experience.
I'm Adrian Smith. I work in HMP Rochester. I'm a service manager for Kent and Medway Substance Misuse Service. I started working in substance misuse about 6 years ago. It was just in the local newspaper. There was a job advertised for a counsellor working in 12-step treatment programs in a prison. I then, through a series of opportunities that presented themselves, became a senior counsellor, a deputy service manager. I then took on an enhanced role, and then I became a service manager. There's, in a sense, 3 parts to a service. However, you wouldn't guess if you were working within them, because they worked in a sense to serve the individual client, and it's just about meeting the client's needs. So I guess you've got no real formal qualifications, just a real willingness and desire. You've got, from that you can be trained into therapeutic if you'd like to go down that road and become more involved in that. Nurses obviously have a core qualification, and the same with doctors and non-medical prescribers. So I think there's loads of scope depending on how you want to come in. If you've got core qualifications, that's fine. We will look to sort of use them. What my role involves really is helping develop and support a team of people so they can deliver the best treatment options available to the clients that we serve. There's nothing stopping nurses actually becoming service managers. I think we actively encourage it. We have a nurse who was a service manager who actually is now our clinical lead. So actually they've actually gone into that position and then actually gone higher. If you're fascinated by people and have a tendency to believe you can make a difference and would like to help them and want to work in an area that is constantly different, because that's the nature of people and environments, and especially working in a prison, which is you know, a microcosm of a completely different environment, then it's for you. You know, there isn't advice. You'll know it's for you.
My name's Julie Isherwood. I'm a forensic nurse practitioner with Kent Police, and I'm primarily based at Medway Custody.
Before I worked for Kent Police, I worked in intensive care as a sister.
I was an acting ward manager at Medway Hospital.
I look after detained persons in custody.
There is no such thing as a typical day. You never know what you're walking into. We obviously look after and maintain the health and welfare of the prisoners. The forensic part of the role is for serious crimes. So if someone's brought in, we deal with the accused rather than the actual victim.
And then on top of that, we have Kent Police staff coming in if they've got injuries that need documenting that could go to court. I go to court if I'm called to court for certain things.
It's a mixture of minor injuries, it's practice nursing, because obviously a relatively well person can come in, but they've got long-standing issues with diabetes, asthma and things like that. So you need to know how to manage their medication, whether or not their medication is there, whether we can get it, whether or not if we can't get hold of their medication whilst they're there, is that going to be detrimental? How are we going to manage that person in custody? And you've got to think about the case itself, the nature of the case. How serious is it? Is it going to be better to try and deal with this person now and here and now without their medication and things like that? So it is a lot of responsibility.
I like being independent in my role, but always having someone to call on. There's only one nurse in the station generally at one time, but we have phones and airwave radios to contact people if we need any assistance.
It's always nice to have a colleague that you can phone up and bounce ideas off.
I like the fact that I work with police officers. I feel very safe in custody.
I think because of the nature of the actual role itself, you are the only person and everyone is looking at you for answers.
The ideal candidate for this role would be a registered general nurse who isn't scared of a new challenge and should really be 3 years post registration.
I think you need to have a wealth of different experiences across the board so that you've got a rounded knowledge.
I think it's a really good opportunity. You learn a lot about nursing people that don't normally wouldn't come to hospital.
It's very much what you make of it, and if you like it, you will flourish.